Let's proceed to diagnosis according to pathogenic Qi with the pattern food stagnation. Food stagnation is similar to blood stagnation and phlegm in that it is often overlooked. Food stagnation tends to be a contributory factor to the other imbalances rather than being a consequence of them. However, several imbalances can lead directly to food stagnation. As with Qi or blood stagnation and phlegm, the symptoms and signs of food stagnation can be easily overlooked. This is because you have to ask about specific signs and symptoms that the client often does, that the client often does not even realize that they have or they do not see as relevant because it is something that they have always had and regard as being normal. Food stagnation can be seen on the tongue and in the pulse, but these signs are often overlooked because they get interpreted as dampness, phlegm, or Qi stagnation. Food stagnation arises when food physically and energetically accumulates in the middle jaw. Food stagnation generally has two consequences that can lead to further imbalances and complications. Food stagnation can block the Qi dynamic of the middle jaw and it can create heat. By physically and energetically blocking Qi in the middle jaw, food stagnation will disrupt and burden the stomach and spleen Qi dynamic. This can lead to stomach and spleen Qi deficiency, rebellious stomach Qi, dampness, damp heat and phlegm, damp heat and phlegm. In addition, a blockage of Qi in the middle jaw can disrupt the communication of Qi between the lower and upper jaw and between the kidneys and the heart. Food stagnation can also disrupt liver Qi in its spreading function. Heat will quickly arise as a consequence of food stagnation. This can initially lead to stomach fire and stomach Qi deficiency and contribute to the creation of damp heat and phlegm heat. When food stagnates in the stomach, it will manifest with a turgid and distended sensation in the epigastric region. Food stagnation creates heat. At the same time, it blocks the stomach Qi from descending. Both of these factors can cause the stomach Qi to rebel. This can manifest as burping, heartburn, and acid regurgitation a while after eating. The belching will usually taste of the food that has been consumed and sometimes will also be accompanied by a small amount of semi-digested food. The disruption of the stomach and the spleen Qi dynamic can result in nausea or poor appetite. When the food is stagnant, it will not be transformed properly and will instead have a tendency to rot and ferment. The combination of untransformed food and heat can also result in the stool being loose and sticky. The stool can also smell rotten like sewage. Food stagnation can cause constipation by stagnating Qi in the stomach and the intestines. Food stagnation can manifest on the tongue with a thick, greasy coating in the middle of the tongue. The pulse will often be wiry and slippery in the middle or one position. So let's take a look at its etiology. Food stagnation can arise as an acute imbalance when too much food is consumed at one time, when food is eaten too frequently or too late in the evening, or when inappropriate food is eaten. That is, food that is difficult to transform. Food stagnation can also be a chronic condition due to spleen and stomach being too weak to be able to perform the respective functions. Dampness, phlegm, and liver Qi stagnation can also be involved. In this case, even smaller amounts of food and even more types of food will result in food stagnation. The foundation for food stagnation can have been laid very early when the person was a baby due to the diet they were fed and the way they were fed. Many babies and toddlers are fed food that is too coarse and unrefined, is too sweet, creates dampness and phlegm, and is too cold. Moreover, many babies are often fed too frequently. This is problematic because the spleen is not capable of transporting and transforming optimally. This can lead to food stagnation, a subsequent weakening of the spleen, and the formation of dampness, heat, and phlegm. So let's go to the symptoms and signs. There will be stuffed or turgid sensation in the stomach after consuming food, abdominal distension after eating, discomfort after eating, loss of appetite, nausea, acid reflux, belching or burping with the taste of previously ingested food, hiccup, bad breath, loose stools with undigested food particles, constipation, stools smell rotten, thick, greasy coating in the middle of the tongue, and the pulse is slippery or wiry in one or both gland positions. The key symptoms, there will be a full sensation or discomfort in the epigastric region, belching that tastes previously ingested food, thick, greasy tongue coating. Treatment principle, disperse and dissolve food stagnation, tonify and regulate qi in the middle jaw. For the acupuncture points, we can choose from REN 11, REN 12, REN 13, REN 22, stomach 21, stomach 34, stomach 36, spleen 4, and pericardium 6. If there is heat, we can add LI 11 and stomach 44. We needle with draining or even method. So REN 11, REN 12, REN 13, REN 22, stomach 21, stomach 54, stomach 36, spleen 4, and pericardium 6 regulate the stomach qi and qi in the middle jaw. LI 11 and stomach 44 drain heat from the stomach and intestines. As a relevant advice, a person with food stagnation should avoid eating too quickly, too much at a time. As a relevant advice, a person with food stagnation should avoid eating too quickly, too much at a time, late in the evening, and foods that are difficult to transform. They must chew their food thoroughly. They will benefit from massaging their abdomen with light downward strokes from REN 16 down to REN 8 immediately after they have eaten. They can also massage the abdomen in a clockwise direction a few times throughout the day. As well as avoiding the consumption of foods that are difficult to transform, they will benefit from using aromatic herbs in their diet and possibly consuming a little bit of cardamom, aniseed, and other aromatic seeds immediately after they have eaten. This will help the stomach and spleen to move qi in the middle jaw. Food stagnation can be caused by the following patterns of imbalance: stomach and spleen qi deficiency, dampness, and qi stagnation. In turn, this can result to qi stagnation, heat, dampness, phlegm, spleen qi deficiency, stomach yin deficiency, and stomach fire. Thank you for your attention.